So she's over in the recovery area right now, and she's waking up. She's actually already talking to one of my nurses, so she's doing really well right now. The couple of things to do, we did both her breasts and her tummy. On her breasts, the most common thing I always tell patients that they have to know is that they're going to feel some pinching pains. When I do the breast lift, I have to anchor the breast back to the muscle, and so there's usually some pinching pains right up here, a couple of them here, and also on the inside part of the lower part of her breast, there's going to be pinch pains when I have to bring everything over from the side over to the front. These will leak a little bit of fluid. It's very normal to see that. So there's dressings over everything, but tomorrow she can go ahead and take off the dressings, and she's already been given a supply of all of her dressings too, so she can change them out to a sports bra if she wants to. She doesn't have to wear our surgical bra. The key thing to remember after these surgeries, there's no drain in there, but the concern will be is that there is swelling for any reason. If she, like maybe she was in bed and she kind of slipped and grabbed herself real quickly and felt a little pop or something and there's swelling, I need to know about it as quick as possible. These are one of those things is where a lot of bleeding and it can put a lot of tension on the breast itself, and that can actually compromise the blood supply to her nipple because everything's been rearranged in there. So that's the key thing. Just if something happens, just contact us, send us photographs, tell us what's going on, and we need to see if we need to get her over here quickly to start trying to fix this. In regards to her tummy, she does have a drain in there. It comes out to the side a little bit right here. This is not our normal place, but we put it there just because we only did it straightly, just the vertical. She already had her previous tummy tuck. Now we just close here. Same thing again. She's going to feel a lot of tightness. The belly button itself is designed to kind of leak a little bit of blood and fluid, so don't be surprised if you see a little bit of blood around there. She does have a compression garment on, and it actually has a line marked on it that your do not pass go line. You don't want to make it any tighter than this. The key thing to remember is that it just can't really roll up on her. She needs to keep it down below the incision line. And like I said, the same thing is that you'll see a little bit of leakage of blood, but don't worry about that too much. It's very normal to see that until it heals. It probably might be just a day or two you see that. We did put a catheter in her because it was a pretty long surgery, and I didn't want you to have to worry about when going on and trying to stop at a gas station and try and get her to go to the bathroom. So she can take, I told her already, if she doesn't remember, but she can take it out later this evening. She's someone who's much more mobile and can walk around because of the surgery we did for her. Most of the time for tummy tucks, I tell them leave it in all overnight. In her case, she can take it out this evening if she wants to. It's not. I've already sent in her scripts to the HEB, so she should be able to pick them up. So.
All right.
Any questions you have?
No.
Okay.